Good morning, friends. On behalf of DocTutorials and RRM, it gives us great pleasure and immense joy to know that you've got wonderful ranks, Dr. Aditya and Dr. Rudri. You have made us really proud, and it is really giving goosebumps to all of us for you to take up pediatric surgery per se as one of the most wonderful super specialties, and more so securing such great ranks. So I'll just take you person by person. You can just introduce yourself as where was your undergraduation, post graduation, how was your preparation, and how Dr. Drills had made an impact in your preparation for your examination. Go, Dr. Rudri.
Hello. Good morning, sir. I have done my MBBS from BJ Medical College, Ahmedabad, and my PG from NHL Medical College and SVP Hospital, Ahmedabad. After that, I took tutorial at the second year of my PG itself to prepare because that is a relatively free time to prepare for MCH exams. And I took there and I saw videos and solved the question banks and gave tests, and that helped very much, when, especially in pediatric surgery, because whatever that is in videos, that is only asked. The questions which were asked were mostly from the videos and the question banks. So that has helped a lot in my preparation. I passed out last year only, and I this is my first attempt in INI. So that was my preparation uh, from Dr. Tutorials.
Great, great. First attempt, INI rank 2 is really amazing. And how did you get interested in pediatric surgery?
Sir. Sir, I always wanted to do MCH, and I didn't want to get limited in certain system or certain organs like cardiovascular or uro or anything. So pedia was my first choice because of that only. Because in that you can explore anything from thorax to urology to gastro to anything. You can have any organ, any system you want. Those, uh, uh, that is also a very good point. And then there is no saturation. That branch is highly unexplored. Very there is lot to explore in that branch. So I was interested in that too. So that's why I selected pediatric surgery.
What do you want to tell your friends who are preparing for INISS? How do you want them to prepare? What are the tips you want?
The tips are the mainly that you need to focus on the textbooks. That textbooks help a lot, and then doc tutorials is also a very good addition. You have to be thorough with your textbooks, and then go with doc tutorials to revise stuff, and then add to your knowledge, because you cannot remember everything from the textbook you have read once or twice. So that's how. And solve as many questions as you can. So that helps a lot with exams, because the as many tests as you give and as many questions as you can, that can lead to confidence, which can have which can by which can you can correct the exam.
So now, and Aditya, can we just
Yes, sir. Sir, my name is Dr. Aditya Shastri. I'm from Mumbai. I finished my post graduation. I did DNB General Surgery from Government Medical College, Kolhapur. In fact, it was quite a funny situation, sir, because I finished my DNB. I passed in Feb, sir, and I got my MRCS result at the same time. So I wanted to go to the UK. I was on the verge of going, sir, but last minute I had a change of plans, and all my seniors, everyone had told me that there's only one the best app is DocTutorials. So I had a lot of exposure to pediatric surgery during my residency, sir. I worked in a pediatric surgery unit for at least a year and a half. So I was quite intrigued by it, sir, because the physiology of children, the way they heal, sir, and moreoverly, I just don't, I feel that, sir, the awareness about pediatric surgery in cities and even in the peripheries is so less, sir. So that's why I found it as an interesting branch, sir. Then my preparation was not that extensive, to be honest. I had just watched the videos from DocTutorials and solved a few MCQs, but my main sources were Bailey and Sabiston, sir. I was quite thorough with that, sir, and DNB expects you to be very thorough with your preparation, sir. So I just a lot of my friends forced me, just give the exam, we'll see what happens. So I just happened to give the exam, sir, and after coming out of the exam, I realized that it wasn't so difficult, sir. It's quite possible, because getting into such big institutes, everyone feels that very difficult. But I would like to tell everyone that it's not so. The questions that are asked to you are quite conceptual. So if you're good in your residency, and if you're thorough with your work, and if you're sincere, then it's quite possible, sir. And moreover, sir, the videos that are on the app, your videos, I found them extremely helpful, sir. Just listening to your videos and seeing the photos that you have uploaded in your videos, that was 50% of my work was done there, sir. After that, I was just revising my notes and going through Bailey and Saveston. My notes were only from Bailey and Saveston, sir. So that helped me, sir. And then I also feel that a lot of this is attributed to MRCS, sir, because the way you answer in the exams. So that helped me in my interview, sir, because my CML rank was 5. So I directly went from 5 to rank 1, sir, maybe because of the way I presented myself and the way I spoke confidently in the interview. And in the interview, they asked lots on your thesis, sir. So that is another thing I would like to tell people, that pay more attention to your thesis, and while you're giving your interview in the INI exam, don't try to fool the examiners, because they have gone through everything and they know how it is. But yes, sir, I would just like to give a message out to my juniors and everyone watching this video, that anyone who is an average student and someone like me who hasn't ever topped in MBBS and who hasn't ever gotten an amazing rank for post graduation, and who's always had a dream to study at such institutes, that keep dreaming, keep believing in yourself. It's not impossible to achieve this. And someone like me who comes from such a background, that it's not impossible. It is very much possible to get into such institutes. And if it's your dream, then keep dreaming. Just trust the process and keep going going with the flow, sir.
Great, ma'am. Rudri, ma'am, you want to add something?
Yes, I just wanted to agree with the part that you have to be thorough with the textbook first. Then, Dr. Tutor is a great tool to revise all the things that you are already read once, and that helps a lot. And the preparation part is also true. The questions were the general surgery questions were really good. I mean, and the pediatric surgery questions were I felt that they were so easy because I have solved the DocTutorial question banks and all, and it felt easy, and it felt that I had seen these questions in the question banks. I have seen the videos, and the questions are from them only. So that was easy for me in exam.
I
Great.
agree with that too, sir. I agree, because every time I read a question in the exam, I used to keep your video, the lines that you keep, you used to teach
Yes, sir.
us a topic, and at the end of it, revise and then revise it again. So that really helps, sir. So anyone who's watching this, I would say, and in fact, sir, I had not even watched the INI surgery videos. I had just watched the NEET SS
General,
videos.
yes, sir. Same here.
That itself has helped me in getting such a great rank, sir. So otherwise, I think the textbooks are more than enough, and your videos cover everything from the textbook and additional stuff that is required from the textbooks like Koren and Ashcraft, sir. So in fact, I would like to tell everyone that I didn't even read Ashcraft and Koren, sir. I just referred to your videos and a few MCQs here and there, sir.
Great, great to know. Great to know people from humble beginnings state and then reach great heights like you guys do. And as you told, I always believe medicine is not just like there is only pure hard work. So every point of time there is no much topper this time. Topper always topper for life. Nothing. Every time you put in some hard work, people like you are great inspiration for many people who are coming about from humble backgrounds, reaching greater heights. And I'm absolutely sure in 3 to 4 years after you complete your super specialty, you will reach much more heights. And 10 years later, it will be very difficult, or 5 years later, to get an appointment to even talk to you. You'll be so busy in the field and you will reach much greater heights. And this is not the end of it. I'm absolutely sure for life we will be there helping you, guiding you, and being through you, and we'll be sharing our experiences in this field of pediatric surgery. And I am extremely happy to welcome you as colleagues, pediatric surgeons, to this wonderful super specialty. Thank you so much for your time and all the very best. And really very, very happy to see you guys achieve such great success. Thank you, both of you.
Thank you so much,
Thank
sir.
you, sir.
Thank you.
Thank you very much.
We can leave, right?
Yeah, yeah, I guess.